So we have Pat today. Pat is one of Dr. Dittbrenner's patients who has been in care coordination pretty much since the start, right?
Oh, I think so, Pat. I think you were one of the first people we enrolled in the healthcare
we
home.
discussed it, I know, maybe for a few months before it started.
So our care coordination program at the Alexandria Clinic has been ongoing since about 2014 when we started our process of becoming a healthcare home, and it's really grown and been shaped and changed by mostly our patients and feedback that we got from them. But really we've been focusing heavily in the last year on how we can really focus on the core of what care coordination is, and that's transferring information between all these different specialties, preventing and eliminating gaps in care, and providing the best care that we can for our patients and for their families as well.
It started out, I think one of the first major health issues that arose, I was diagnosed with type 2 diabetes. That didn't, I was concerned about it, but it didn't bother me because in my professional life, I was working with 4 brittle diabetics.
Mm-hmm.
So I had a lot of information about that. So that wasn't so hard. But I got really sick and I got hospitalized twice. I ended up in the emergency room 3 times, hospitalized twice. And the next thing I knew, I was in an ambulance heading to St. Cloud, and I have 2 house cats at home that are my babies. And I'm having a fit, a bird. I can't do this. And I was down there for 10 days. With what I have, it was hard getting information. I had this little sheet of paper, but I was online doing a lot of researching and asking a lot of questions when I met with the specialist and so on. And it's really scary when you've been pretty healthy. Yeah, I had the diabetes, but it was, it wasn't well controlled, but I knew what to do with it. But then I found out I had stage 4 kidney. Stage 3, stage 4, I was kind of on the edge of that. And that really bothered me because my biggest fear in life is that I'm going to have to go into dialysis.
Mm-hmm.
So I wasn't real happy about that part. I felt like I was kind of in charge of my life and had been. I've been in charge of other people's lives for years.
Yes, you have.
So it didn't quite make sense to me until you explained it from your point of view, and then it made more sense.
What did I say that made you?
Well, you just said that my case was complicated, which we all understand, and the fact that I was working at that time with 3 specialists in St. Cloud, so there had to be a lot of coordinating, and I can do the appointments and make sure that I'm staying on top of those, but there are things that happen behind the scenes that you explained, and that had to be more for, you and the specialists that we were working with at that time. And not only that, but the specialists in St. Cloud too, all of them mentioned the fact that, that what we were doing, what you were doing, what we were doing made their job a lot easier. It's like they got the information they needed, and you did explain that to me when we were talking about it. And not only that, but they knew that you would send the information to them. They weren't constantly having to call to get that information.
Right.
So it made their job easier, and therefore everything was working a lot better.
Mm-hmm. And one of the things that we talked about is the ability to keep you out of the emergency room, out of the hospital, out of skilled nursing facilities, because I believe as a family doctor that patients do not want to be there. They want to be with their primary care doctor or their specialist at clinical visits. They'll do that every week of the year rather than stay overnight in the hospital.
So what made the difference? So you were going through this without care coordination, and then you, Dr. Dittbrenner, and you agreed that you have care coordinator involved.
Mm-hmm.
What changed?
The fact that I didn't really understand what all was going on from your side of it.
Mm-hmm.
So once we had that heart to heart, and you were telling me what you had to do in order to keep this going, it made more sense to me, because I was looking at it from, the appointments and getting the information, that I could do online and wherever else I could come up with information, asking the questions from the doctors and so on. But there were so many things going on behind the scenes that I was not aware of.
Right.
And once that was explained to me, that's when I decided that, yes, it made sense to do this.
Yeah, what we're doing in medicine that you weren't aware of, you know, how we're
Mhm.
trying to coordinate your care and how it gets hard. And one of the things I say to patients when I'm trying to talk them into care coordination is, I can take so much better care of you if I have help, if I have my team helping me.
Mhm.
Because I get told when things are happening and when appointments have occurred and when I need to update medications or how a medication has changed. Otherwise, I have to go digging for it and wait. Because when I change things, or when we change things here, or when a cardiologist changed it, everybody was being informed because of care coordination. So what do you love best about care coordination?
Being able to get answers to my questions in almost, within just a short period of time. That is, that's probably the most important thing.
So our care coordinators work very closely with our providers. Usually we try to have them right on the station so that just like any other nurse and provider team, the care coordinator can stop Dr. Dipperner in between patients and say, I know you're really busy, I'm sorry, but I have a question from Pat that really needs an answer and it needs it right now.
One of the things that I had felt I had to do at the beginning was I needed to fight for my own input and independence.
Mm-hmm.
And as the care coordination came into it, I didn't have to do that because my opinions and my questions and so on were respected.
What we do in healthcare home is we work as a team, really. I have to let go of things and let everybody help me take better care of you because of the complexities.
So do you feel like you're a part of our team? Do we do a good enough job of including you in that?
I wouldn't have it any other way.
Good.
I'm pretty fortunate because as serious as my diagnoses, and they've got several, are, I'm actually doing extremely well right now. And part of that is, having everything coordinated, having access to the people I need to have access to. And it definitely is one of the reasons that I'm doing as well as I am right now. And